I'm Dr. Narsingh Verma, and I will be presenting you the updates from APICON, Day 2 updates from APICON, Jaipur 2022. I'm professor at KGMU, Lucknow, and today we had some very important topics presented in the API. Some of them are managing heart attacks, Glasgow practical approach, and chrononutrition, a new dietary dimension, the immunity and role of vitamin C, Indian Kalazar from 1 month to single dose treatment, and API initiated therapy specific recommendations in teleconsultation. So first I will take the managing heart attacks, Glasgow practical approach. This was very useful presentation because these patients are coming day and night to our physicians and they are managing heart attacks. So this Glasgow practical approach can help them in managing patients. Angiographic studies have indicated that many cases, medium-sized plaques, where the stenosis is 30 to 40%, they are more likely to rupture rather than the large one are more obstructive. So obstructive nature is not that important. It is the size, medium-sized plaques are more important. Moderate plaques may be vulnerable because they are less mature and with a large lipid core and thin cap, prone to rupture or erode, exposing the thrombogenic subendothelial components. So they are having more chances to rupture. Although one PCI is clearly superior to thrombolysis, when looked at establishing the primary PCI service in Glasgow, it was obvious that it is not practical or feasible to offer primary PCI to entire population. So in the 18-20 years, the primary PCI is the dominant treatment and risk-curve PCI is a very limited number. So that is why this becomes very important. The key from this study was the microvascular obstruction remains one of the most challenging situations to manage during primary PCI. Although there is no ideal pharmacomechanical management strategy, a treatment plan should be tailored to individual patients who may benefit from a specific therapy that is fitter in SVG PCI. The concept of routine thrombus aspiration, covered stent, self-expandable stents, direct stenting, and the antagonist of the platelet receptors are intuitive and feel right, but are not a proven efficacy. So till we have more data, we have to manage our patients by whatever we have. The second talk, which was important, was the chrononutrition, a new dietary dimension. Chrononutrition is an emerging field of nutritional science that aims to develop understanding of meal timing and its impact on health. Not only the type of meal, but also the time of meal was considered. Chrononutrition encompasses 3 dimensions of eating behavior. In these 3 components, one was the regularity, at what time the food was taken, and the timing and frequency with the focus on influence on energy expenditure and body weight. So here it was considered that not only important is that what you eat, and it is important that when you eat. So timing was considered, and increasing meal frequency was found to induce weight loss and improve metabolic parameters like the fasting blood sugar, insulin, cholesterol, and triglyceride, thus reducing the risk of developing type 2 diabetes and coronary vascular disease. So just increasing frequency was found to reduce the weight loss. ADA recommends that for weight management, the total calorie intake should be distributed in 4 or 5 meals. So that recommendation is very well in line of chrononutrition, including breakfast, which may be a better strategy than the concentration of consumption in the few meals to prevent weight gain and related disease. So those of our patients who say that, doc, I'm taking only 1 meal, so that may be responsible for their weight. So that meal had to be divided into frequent meals. So key takeaway from this was circadian rhythmicity influences the essential processes of metabolism and energy expenditure, and feeding time helps to decide on the expected benefit with diabetic specific nutrition. Partial meal replacement with DSN is one strategy to help obese diabetics to lose body weight. And type 2 diabetes in the first decade of life is reversible. Here, the important fact is first decade of life, particularly with lifestyle. So, reversibility is possible by lifestyle, including low calorie diet, meal replacement with diabetic specific nutrition formulas. So, that was the takeaway from the chrononutrition studies. Another important talk was immunity and role of vitamin C. Vitamin C has been advocated for the most of the benefits in various conditions. And here, the prevalence of vitamin C deficiency is highest among Indians. It was found that the Indians are having the deficiency of vitamin C. People with diabetes have at least 30% lower vitamin C concentration than non-diabetic. So for diabetic individuals, vitamin C replacement may be necessary sometimes. Vitamin C prevents end organ damage in diabetes by functioning as an antioxidant, inhibiting the intracellular accumulation of sorbitol and reducing the glycosylation of protein. So we know that the sorbitol and the glycosylation end product mechanism is very important, and this mechanism, if can be inhibited by any antioxidant like vitamin C, that is more than welcome. Vitamin C protects end organ damage in CVD and hypertension via scavenging highly reactive free radicals and oxides, nitric oxide production, improving vascular endothelial function, inhibiting oxidation of LDL protein, thereby reducing atherosclerosis. So it will also have impact on one of the major complications of diabetes in the form of reducing burden of CVD. So key takeaway from this was need to boost immunity as patients of non-communicable diseases are vulnerable to recurrent infections, repeated infections, lead to micronutrient deficiencies in patients with NCDs. Cooking of vegetables and fruits can reduce their vitamin C level by 20 to 40%. So that is why half-cooked vegetables can be advocated. Supplement uses prevents vitamin C deficiency. So sometimes it becomes necessary to supplement vitamin C, which is not very costly and can be done very easily. Immunity can be boosted by having balanced diet, adequate sleep, and preventing infections. So by this, vitamin C has a very vital role to play. Indian Kalajar, from 1 month to single dose treatment landscape we see in India in the past 70 years. Visceral leishmaniasis therapy was based on pentavalent antimonial sidocroclinate with amphotericin B and pentamidine as second-line drugs. SBV associated less than 5%. In 2020, Indian National Expert Committee recommended use of amphotericin B deoxycholate as first-line agent in areas with more than 10% SBV unresponsiveness. So this recommendation became very important, and what significant changes in the treatment of Kalajar was approved in India. Single-dose liposomal amphotericin B became the treatment of choice, and its use in Kalajar elimination program was helped in achieving the goal. Multi-drug treatments have shortened the duration of treatment. If you remember, the same single-dose liposomal amphotericin B was used to treat the black fungus, which came after our COVID patients. WHO recommended treatment regimens for visceral leishmaniasis are liposomal amphotericin B 3 to 5 milligram per kg per daily dose by infusion given only over 3 to 5 days period up to a total dose of 15 milligram per kg by infusion or 10 milligram per kg a single dose by infusion. Combinations co-administered liposomal amphotericin B 5 milligram per kg by infusion single dose plus miltefosine daily for 7 days as below. Liposomal amphotericin B 5 milligram per kg by infusion single dose plus paramomycin daily for 10 days. The mitefosine plus paramomycin both daily for 10 days. So that is the recommendation by WHO. Amphotericin B deoxycholate 0.75 to 1 milligram per kg per day by infusion daily or on alternate days for 15 to 20 doses. The miltefosine for children aged 2 to 11 years, 2.5 milligram per kg per day. For people aged 2 to 12 years and less than 25 kg body weight, 50 milligram per day, 25 to 50 kg body weight, 100 milligram per day, and more than 50 kg body weight, 150 milligram per day, orally for 28 days. Or paromymosine, 15 milligram per kg body weight per day, intramuscular for 21 days. Another important talk was presented was API-initiated therapy specific recommendations in teleconsultation. This teleconsultation, you all know, became very, very popular during the COVID times. And the advantage of telemedicine are they can save time for the patient and caregiver, consult with different specialists irrespective of their location, and result in a better doctor-patient relationship, and the follow-up of patient is likely to be better, which may improve outcomes. Of course, it burdens doctors, but for patient, it is very, very useful and gives access to remote areas and to those with mobility issues, power to overcome geographical barriers, the opportunity to reduce healthcare spending. So key takeaway from this presentation was institution of regulatory authority, standard format of the information, a consent form with the option to opt in and out mandatory telemedicine courses for all medical students. That is very much required, and refresher course for medical practitioners, technical staff may contribute to telemedicine success. If you all remember, during COVID days, most of the medical education was imparted via the telemedicine. Responsibility for privacy, confidentiality, and security of patient information and treatment, accreditation, licensing of doctors using telemedicine, and building the confidence of both the patient and the distant doctor is critical for telemedicine. And the telemedicine laws for information storage and access to dedicated staff to manage telemedicine should be formulated and supervised on a regular basis. So that was an important issue, because once the telemedicine becomes more popular, we will definitely face all these problems. So regulatory authorities and the registration is important. Also, the privacy and confidentiality and security of patient is important. So thank you very much for giving this opportunity and for presenting the second day highlights of the APICON Jaipur. Thank you very much.